Welcome to the weekly dose of self-care, where you learn to manage a medical condition in 5 minutes. So today, we're going to learn about how to manage heartburn in just 5 minutes. But what is heartburn? So when you get heartburn, you get symptoms like a burning sensation in the chest, you get a bad breath, you have difficulty breathing, some discomfort in the throat area, and a cough that won't go away. And you also feel there's like a bitter or sour taste inside the mouth. You can manage the symptoms of heartburn by yourself if you do not have the following red flags. If you happen to have a loss of appetite that leads to weight loss, or you have difficulty swallowing, or it's painful when you swallow, then that is a sign when you should go see the doctor. As always, it is recommended to use non-medication approaches to managing your symptoms first. So the first thing you can do is to avoid lying down for 30 minutes after eating. The next thing is that you can avoid eating high-fat meals just because it takes a longer time for the stomach to digest the food, which increases the chances of things going back up and causing heartburn. You can also try to decrease your caffeine intake. And lastly, if your heartburn symptoms are usually around bedtime, then not eating any food 3 hours before going to bed will help decrease the chances of having heartburn. When you walk into the pharmacy, there are multiple over-the-counter medication to help with heartburn, but you might get confused as to which one you should choose first. So I'm going to go through each medication and then let you know how to choose between them. So as you go from top of the list to the bottom, the effect of the medication is the strongest when you hit Nexium at the bottom. Now you know how strong each medication is, but then how do you choose which one to use? So it depends on whether your symptoms are mild, moderate, and severe. And this will depend on the frequency in which the heartburn happen, as well as when they happen. So your symptoms are considered mild to moderate if you have heartburn symptoms with a known trigger. So let's say you eat a certain food and you know that you will get heartburn from it. So this is when you could use Tums and Gaviscon to basically help with the symptoms. And frequency-wise, this is when the symptoms are less than once per week. In terms of how to use the medication, it depends on the dosage, so just refer to the directions on the packaging. But for Gaviscon, you must chew the tablets in order for the medication to work. But if your symptoms happen less than 3 times per week, or it usually happens at nighttime, it is now considered more moderate to severe. And this is when you need to use Pepcid. So if you have a current symptom right now, then you chew 1 tablet once per day when needed. But if you're trying to prevent it from happening, you can take 1 tablet 30 minutes before the trigger. And the effects will kick in 1 hour and will last 4 to 10 hours. But it is very important to know that if you use this medication on a regular basis, then it will lead to a decrease in the effect of the medication. Now, if the symptoms are greater than 3 times per week, or you try other medication and they did not work, then your best bet now is to try Nexium. So you take 1 capsule once per day, you take it half an hour before food, so the effects of the medication will be the best. The effects will kick in roughly in 1 hour, and the effects will last roughly 1 day. The next episode will be aired in a week. If you like what you're hearing, remember to subscribe and like.